short word about sterility. Every single operative procedure requires completely, perfectly sterile instruments. We achieve that by the use of this autoclave. It treats the instruments at high temperature and high pressure to achieve that perfect sterilization. My assistant, Joy, will explain in a little bit more detail. Sterility of the instruments is achieved and monitored by several mechanisms. Joy, would you explain to us how that works?
One thing we use is a biological spore tester that is used daily to monitor the sterilizer itself, an integrator that verifies that the steam and the temperature is achieved, and also an indicator inside each pack that shows that the steam penetrated and the sterilizer reached its temperature.
So, Joy, do you think that this mechanism is adequate for achieving sterilization for our tools?
I think it's more than adequate.
Thank you so much. Our series of consultation information tape, and today we're going to talk about facelift. The facelift patient, Sevilla, our model, doesn't need a facelift, but she's been kind enough to lend her pretty face for us to use. So, facelift. The usual facelift patient is someone who desires improvement of the neck and cheeks. To achieve that, we have to make an initial incision. The initial incision is made beginning in the scalp above the ear, continues down along the ear and cheek junction, and there are various techniques and methods of how to do that, and your plastic surgeon will choose one, around the lobe, and then into the post-auricular crease, and then on into the scalp. So the incision for a facelift is fairly lengthy. However, most of it is hidden by the hair behind the ear, hidden by the hair in the scalp, and usually women can camouflage additional portion of the incision by having the hair drop down a little bit. Now, once the incision is made, the cheeks and the neck are then advanced to a satisfactory position, the excess removed, and then the incision site carefully closed. The main complications or risks with facelift, other than the permanency of the incision, sometimes we lose a little bit of hair at the incision site where we cut into a scalp. Sometimes we have a few follicles we lose, but usually not very visible. Bleeding and infection, as with all other mentioned procedures, there is some sensory and motor nerve damage that can occur on the face, and we'll cover that in more detail during your consultation. So facelift incision in the scalp, front of the ear, behind the ear, the goal to restore the youthful appearance of the neck and cheeks. Thank you. Hello, Dr. Tom here, continuing in our attempt to communicate with you pertinent information prior to you and I meeting for your consultation. Keep in mind, cosmetic surgery can help you be your best. We'll help you to make your right choices. Also keep in mind, every operative procedure has benefits and risks. We'll discuss those in detail during our live consultation. I hope that this video has helped serve as an introduction to your consultation process, and hopefully you'll develop some good questions, and we'll move forward now with your consultation. Thank you so much. See you soon.